A silent threat. 8 signs that could indicate diabetes. Diabetes, medically known as hyperglycemia, is a concerning condition marked by elevated blood sugar levels. When left unattended, it can lead to a myriad of complications, triggering a cascade of health issues, including the development of cardiovascular problems, kidney disease, nerve damage, and vision impairment. Moreover, diabetes can be associated with obesity, genetic factors, a sedentary lifestyle, or poor dietary choices. Over time, progressive insulin resistance can occur, characterized by the body's inability to effectively use insulin, known as type 2 diabetes. This metabolic disorder results in the body's failure to regulate blood sugar levels, alarming considering that more than 400 million adults worldwide grapple with diabetes, largely due to various contributing factors. One prominent contributor to diabetes is the overconsumption of refined sugars. These sugars, often found in processed foods and sugary beverages, promote insulin resistance, hindering the normal functioning of this vital hormone. Additionally, an excess of high glycemic index foods in one's diet can exacerbate the issue, as these sugars are converted into glucose, leading to spikes in blood sugar levels that strain the body's insulin response. The consumption of trans fats poses another substantial risk, as it activates specific genes that instruct the body to resist insulin, further complicating the diabetes landscape. In this video, we'll delve deeper into the intricate web of factors contributing to diabetes, explore its far-reaching consequences, and discuss strategies for prevention and management. Number 1. Frequent urination. While it's true that everyone needs to visit the restroom regularly, if you find yourself making multiple trips to the bathroom, especially at night, it could be a sign of something more significant. When your blood sugar levels rise, your body tries to expel the excess glucose through urine. This increased sugar content in the urine can make you feel the urge to urinate more often, especially in the early hours of the morning, as your body produces more concentrated urine while you're sleeping. So, if you're constantly feeling the urge to visit the restroom, even after what feels like just a few moments, don't brush it off as a harmless habit. It could be a subtle sign that your body's trying to tell you something important. Of course, frequent urination can be caused by other factors, such as dehydration, urinary tract infections, or even certain medications. But if you're concerned about the frequency of your bathroom visits, it's always a good idea to consult your doctor to rule out any underlying health issues and determine the root cause. Number 2. Increased thirst. While thirst is a natural sensation that prompts us to drink fluids to stay hydrated, an excessive and persistent urge to quench your thirst could be a red flag for diabetes. When your body's ability to regulate blood sugar levels is impaired, as is the case in diabetes, the excess glucose accumulates in the bloodstream. This excess glucose draws water from cells and tissues, leading to dehydration. To compensate for this dehydration, your body sends signals to the brain, prompting you to drink more water. This increased thirst can be particularly noticeable, often described as an insatiable or overpowering urge to consume fluids. While increased thirst can also be caused by other factors, such as hot weather, fever, or certain medications, it's crucial to pay attention to its intensity and persistence. If you find yourself constantly reaching for water, even after drinking a significant amount, it's time to consult your doctor. Number 3. Extreme hunger. While it's normal to feel hunger after a meal or between meals, experiencing persistent and intense hunger that doesn't go away even after eating could be a cause for concern. When your body's ability to regulate blood sugar levels is impaired, as is the case in diabetes, your cells struggle to utilize glucose for energy. As a result, your body starts breaking down fat and muscle for fuel, leading to weight loss. This metabolic process releases hormones that stimulate appetite, causing you to feel hungry even after consuming a meal. This persistent hunger can be overwhelming and disruptive to daily life. While extreme hunger can also be caused by other factors, such as thyroid disorders or medications, it's important to pay attention to its intensity and frequency if you suspect it might be related to diabetes. If you find yourself constantly snacking or feeling unsatisfied after meals, it's time to consult your doctor. Number 4. Blurred vision. While it's common for vision to change slightly as we age, sudden or persistent blurring could be a sign of diabetes. When blood sugar levels rise, the lens of the eye, which helps focus light onto the retina, becomes swollen. This swelling can distort the shape of the lens, resulting in blurred vision. Blurred vision caused by diabetes can affect near vision, far vision, or both. It may also cause vision to appear hazy or distorted. In some cases, it can lead to difficulty reading, driving, or seeing fine details. While blurred vision can also be caused by other factors, such as eye strain, cataracts, or glaucoma, it's important to consult a doctor if you experience sudden or persistent changes in your vision. Early diagnosis and treatment of diabetes can help prevent permanent vision problems. Number 5. Slow healing of wounds. While minor scrapes and cuts typically heal within a week or two, persistent wounds that take longer than expected to heal could be a sign of diabetes. When blood sugar levels are high, the body's immune system and circulatory system become impaired. This can make it difficult for the body to fight off infections and deliver oxygen and nutrients to injured tissues, leading to slow wound healing. Slow healing wounds can be a sign of other health conditions, such as anemia or nutritional deficiencies. But it's important to consult a doctor if you notice that wounds are taking longer than usual to heal. Early diagnosis and management of diabetes can help prevent complications and improve wound healing. Number 6. Recurrent infections. While everyone experiences occasional infections, such as colds or sinus infections, having them frequently or finding it difficult to recover from them could be a sign of diabetes. When blood sugar levels are high, the body's immune system becomes weakened. This impaired immune system makes it more difficult for the body to fight off infections, making it more susceptible to recurrent and persistent infections. Recurrent infections can occur in various parts of the body, including the skin, bladder, urinary tract, and lungs. These infections may take longer than usual to heal and may require more aggressive treatment. While recurrent infections can be caused by other factors, such as a weakened immune system due to other medical conditions or medications, it's important to consult a doctor if you find that you're getting infections more often than usual or that they're taking longer to heal. Early diagnosis and management of diabetes can help improve the immune system and reduce the risk of recurrent infections. Number 7. Irritability. While everyone experiences occasional mood swings, experiencing persistent irritability or mood changes that are out of character could be a sign of undiagnosed diabetes. When blood sugar levels are high or low, it can affect the brain's ability to regulate emotions, leading to irritability, moodiness, and anxiety. This is because high blood sugar levels can cause inflammation in the brain, while low blood sugar levels can lead to a lack of glucose reaching the brain, affecting its function. Irritability or mood changes can be subtle and easily overlooked, often dismissed as stress or fatigue. However, if you notice a persistent change in your mood or a tendency to get easily annoyed or frustrated, it's worth consulting a doctor. Early diagnosis and management of diabetes can help regulate blood sugar levels and improve mood stability. While irritability can also be caused by other factors, such as stress, anxiety, or hormonal changes, it's essential to pay attention to its intensity and persistence. If you find yourself experiencing frequent bouts of irritability or mood swings that are impacting your daily life, it's time to seek medical advice. Number 8. Breath odor. While bad breath can be caused by various factors, such as poor oral hygiene, sinus infections, or certain medications, it can also be a sign of diabetes. When blood sugar levels are high, the body starts breaking down fat for energy, producing ketones, which are acidic byproducts. These ketones can sometimes give the breath a fruity or acetone-like odor, similar to nail polish remover. Breath odor caused by diabetes is often described as a sweet, fruity, or metallic smell. It may be noticeable throughout the day, but it's often worse in the morning when ketone levels are typically higher. While breath odor can also be caused by other factors, such as periodontal disease, dehydration, or certain food consumption, it's important to consult a doctor if you notice a persistent fruity or acetone-like breath odor, especially if you're experiencing other symptoms of diabetes, such as frequent urination, increased thirst, or unexplained weight loss. How to manage and reverse diabetes. 1. Fasting. Fasting has emerged as a potential therapeutic approach for managing diabetes, offering promising benefits that extend beyond traditional dietary interventions. While the idea of abstaining from food may seem counterintuitive, scientific studies suggest that controlled fasting can have positive effects on blood sugar levels, insulin sensitivity, and overall metabolic health in individuals with diabetes. Fasting has been shown to allow cells to respond more efficiently to insulin and help to lower blood sugar levels. Additionally, fasting has been associated with other health benefits, such as improved cardiovascular health, reduced inflammation, and enhanced cellular repair processes. 2. Avoid refined carbohydrates. Refined carbohydrates, the refined, processed version of their whole grain counterparts, are stripped of their natural fiber, vitamins, and minerals during the manufacturing process. Think of white bread, sugary cereals, and pastries. Staples in the modern diet that, unfortunately, contribute to the rising tide of diabetes. When we consume refined carbohydrates, our bodies rapidly convert them into glucose, causing a sharp spike in blood sugar levels. For someone with diabetes, this roller coaster of blood sugar fluctuations can wreak havoc on their delicate balance of insulin production and utilization. By steering away from refined carbohydrates, individuals with diabetes can take a proactive stance in managing their health. Whole, unprocessed foods, rich in fiber, become the cornerstone of a diabetes-friendly diet. These nutrient-dense options release glucose more gradually, preventing the drastic spikes and crashes associated with refined carbohydrates. Swap that sugary cereal for a bowl of steel-cut oats topped with fresh berries. Choose whole grain bread over its refined counterpart. Embrace the vibrant array of fruits, vegetables, and legumes that provide essential nutrients without the blood sugar roller coaster. Beyond diabetes management, steering clear of refined carbohydrates offers a myriad of health benefits. Weight management becomes more attainable, heart health improves, and energy levels stabilize. This dietary shift isn't just a prescription for diabetes, it's a holistic approach to fostering overall well-being. 3. Avoid added sugar. Added sugar, the stealthy saboteur hiding in many of our favorite foods and beverages, is a key contributor to the diabetes epidemic. From sugary drinks to processed snacks, our diets are often laden with excess sugar that wreaks havoc on our blood sugar levels. When we consume added sugars, our bodies undergo a rapid influx of glucose, causing a surge in blood sugar. For individuals grappling with diabetes, this surge poses a significant challenge in maintaining the delicate equilibrium of blood sugar control. Rather than succumbing to the allure of sugary concoctions, savor the sweetness of natural alternatives. Fresh fruits, such as berries and apples, offer a delightful sweetness, accompanied by essential vitamins and fiber that regulate sugar absorption. Becoming a savvy food label detective is a crucial skill on the journey to a sugar-free lifestyle. Scan labels for hidden sugars, disguising themselves under aliases like sucrose, high fructose corn syrup, or agave nectar. Awareness is the first step toward empowerment. 4. Vitamins and supplements. Cinnamon is not just a spice to enhance flavors, it's a secret weapon in the fight against diabetes. Research suggests that cinnamon may improve insulin sensitivity, helping cells absorb glucose more efficiently. Chromium plays a vital role in glucose metabolism. It enhances insulin sensitivity, facilitating the movement of glucose from the bloodstream into cells. By including chromium-rich foods like broccoli, whole grains, and nuts in your diet, you support your body in maintaining a more harmonious balance in blood sugar levels. Vitamin B1, or thiamine, is essential for nerve health and glucose metabolism. For individuals with diabetes, thiamine can be particularly beneficial in preventing complications associated with nerve damage. Whole grains, legumes, and lean meats are rich sources of thiamine, making them valuable additions to a diabetes-friendly diet. Alpha-lipoic acid, a powerful antioxidant, offers a dual benefit for those managing diabetes. Not only does it help reduce oxidative stress, but it also aids in glucose uptake. Found in foods like spinach, broccoli, and organ meats, alpha-lipoic acid serves as a protective shield against the damaging effects of free radicals while contributing to overall metabolic health. Bitter melon, a staple in traditional medicine, has gained recognition for its potential to lower blood sugar levels. Packed with bioactive compounds, bitter melon may mimic the effects of insulin, promoting the efficient utilization of glucose. Including this unique vegetable in your diet introduces a natural, diabetes-friendly ally that supports overall metabolic health. Green tea, celebrated for its antioxidant-rich profile. Studies suggest that the polyphenols in green tea may improve insulin sensitivity and regulate blood sugar levels. By incorporating this ancient elixir into your daily routine, you not only promote metabolic health, but also indulge in a soothing ritual that nourishes both body and soul. Found in the skin of red grapes, resveratrol has garnered attention for its potential benefits in diabetes management. This natural compound may enhance insulin sensitivity and protect against complications associated with diabetes. Enjoying a glass of red wine in moderation, or including red grapes in your diet, introduces a tasteful strategy for supporting your metabolic well-being. Magnesium plays a crucial role in glucose metabolism. It helps insulin transport glucose into cells, contributing to stable blood sugar levels. Nuts, seeds, leafy greens, and whole grains are excellent sources of magnesium. 5. Probiotics. The gut microbiome not only aids in digestion, but also contributes to immune system regulation, nutrient absorption, and even mental health. The cornerstone of a gut-friendly diet lies in the abundant presence of dietary fiber. Fiber, found in fruits, vegetables, whole grains, and legumes, serves as a delectable feast for our gut bugs. As these microorganisms ferment fiber, they produce short-chain fatty acids, which contribute to a healthy gut environment, reduce inflammation, and support overall well-being. Probiotics, the friendly bacteria found in fermented foods, are like the virtuosos of the gut microbiome. Incorporating yogurt, kefir, sauerkraut, kimchi, and other fermented delights introduces live cultures that enrich the microbial diversity in your gut. Foods like onions, garlic, bananas, and asparagus are also prebiotic powerhouses. Polyphenols, plant compounds with potent antioxidant properties, offer a dual benefit by supporting both your health and your gut bugs. Berries, dark chocolate, green tea, and colorful vegetables are packed with polyphenols that promote a diverse and flourishing gut microbiome. 6. High-quality fats. Good quality, healthy, natural fats are not the enemy, but rather the allies we need for optimal well-being. Avocados, olives, almonds, and their kin are not just indulgent treats. They are nutritional powerhouses that can transform not only the way we eat, but also the way we perceive fats. Healthy fats are essential for various bodily functions, including hormone production, cell structure, and nutrient absorption. Heart health. Monounsaturated fats, abundant in avocados, olives, and almonds, have been associated with improved cardiovascular health by reducing bad cholesterol levels. Satiety. Including healthy fats in your meals adds a layer of satiety, helping you feel fuller for longer and curbing unnecessary snacking. Nutrient absorption. Fat-soluble vitamins A, D, E, and K require fat for absorption. Including healthy fats in your meals ensures that you reap the full benefits of these essential nutrients. Brain function. The brain is composed largely of fat, and healthy fats contribute to cognitive function and overall brain health. And now I encourage you to share your experiences and thoughts in the comments below. Together, we are winning health. I hope you enjoyed this video. Please like, subscribe, and hit the notification bell for more health-related videos. Thank you for watching.